right side. Right side. Right side. It is on the upper border of right third costal cartilage. So be very specific. It is costal cartilage and it is not the ribs. It is costal cartilage. So in the right border, it corresponds to the upper border of right third costal cartilage. That is 1.2 centimeter from the margin of the sternum. From the margin of the sternum, it is 1.2 centimeter and it is in the right third costal cartilage. So this is the first point. So right side, third costal cartilage, upper border 1.2 centimeter away from the margin of the sternum. So second point is the apex. Apex, we all know about the point in the apex, that is the fifth left intercostal space. This is in the left side, fifth left intercostal space, 7 to 9 centimeter from the midline. So it marks the apex beat of the heart and it is in the left side. So this is the second point. So first point, left side, third costal cartilage, upper border 1.2 centimeter away from the sternal margin. Second point, apex, left fifth intercostal space, 7 to 9 centimeter from the midline. And next point is, there is a point on the left side. Again, left side, lower border of second costal cartilage. Left side, lower border of second costal cartilage, which is 1.2 centimeter from the sternal margin. So these are the three important points. And we are joining all these 3 points so that we will get the right lateral border, left lateral border, and also the upper border of the heart. And when we join the apex with the point which is in the right side, which marks the tricuspid valve, you will get the surface anatomy of the heart. So these are the 4 points. One is in the right side, which is in the upper border of the third costal cartilage. Second in the left side, which is in the lower border of the second costal cartilage. Third is the apex, and fourth is the point nearer to the tricuspid valve. So these 4 points are the surface anatomy of the heart. So I think this is very clear.
Please, 1 minute. Dr. Shalini, please mute. Dr. Shalini, please mute yourself.
Thank you very much. Last time.
Dr. Krishneswari, you please unmute and start.
Audible? Sir? Sir, kekamo?
Yes, yes.
Okay, sir. Okay. So, borders of the heart, there are 4 borders: upper, right border, lower border, and left border. And upper border, it constitutes the 2 atrium of the heart. So, this is the upper border of the heart. And so, this is the right atrium, and behind is the left atrium. And this constitutes the upper border. And this upper border is masked by this aorta and the pulmonary trunk. I think this is clear. So upper border, it is very, very important because dealing with the ECG will be saying that this lead will be seeing the lateral border of the heart. This lead will be seeing the inferior border of the heart. So in order to know that, in order to interpret the changes, it is very important to understand all these things. So this is the upper border. It is formed by the right atrium here and left atrium behind, and also the aorta and the pulmonary trunk. So this is the upper border of the heart. Then there is a right border. This is the right border of the heart, and the right border is formed by the right atrium. This is the right atrium, this is right ventricle, and this is the left ventricle. So right border, it is formed by the right atrium of the heart. Next, there is left border. Left border, it is formed by the left ventricle of the heart. And there is a lower border or inferior border, and it is formed mostly by the right ventricle. So this marks the right ventricle of the heart, and it is formed by the right ventricle and a small portion of the left ventricle or apex of the heart. So these are the four borders of the heart: upper border, right border, left border, and the inferior border of the heart. Upper border, it is formed by the right atrium and left atrium, and also aorta and the pulmonary trunk. Right border, it is formed by the right atrium. Left border, it is formed by the left ventricle, and inferior border, it is formed by the left ventricle as well as a small, it is formed by the right ventricle and also a small part of the left ventricle. So these are the four borders of the heart, and this left border, it is known as the obtuse border, OBTUSC, obtuse border, and inferior border is known as the acute border of the heart. Acute border of the heart. These are the four borders of the heart. Next, regarding the surfaces of the, so regarding the surface of the heart, it is very easy to understand. So there is a anterior surface. So this marks the anterior surface of the heart, and this anterior surface is also known as it is known as costal surface, sternocostal surface. Sternocostal surface because this anterior border faces the sternum and also costal surface, costal margin. So it is known as the sternocostal surface, and it is formed by mostly by the right ventricle and also part of left ventricle. Right ventricle and part of left ventricle. And the second surface is apex. Apex is formed by the left ventricle. Next is base. Base is present behind the behind the sternocostal surface or opposite to the apex, and this base is formed by left atrium. Base is formed by left atrium. It is here behind this the right atrium. Behind the right atrium or the opposite side of the apex is the base. It is formed by the left atrium, and there is something known as diaphragmatic surface. Diaphragmatic surface that is near the inferior border of the heart. It is formed by the left ventricle, mostly the left ventricle and also the small part of right ventricle. And there is right pulmonary surface and left pulmonary surface. Right pulmonary surface is formed by the right atrium and the left pulmonary surface is by the left ventricle. So these are the surfaces of the heart. So regarding the cardiac cycle. So cardiac cycle, as far as ECG is concerned, cardiac cycle is having some importance. But while we are talking about the valvular heart disease and ECG changes, it is very, very important to learn about the cardiac cycle. So we will see the most important events that are taking place in a cardiac cycle. So cardiac cycle is the sequential or cyclical events taking place during a heartbeat is known as cardiac cycle, and it lasts for 0.8 seconds. And the most important processes or most important what cyclical events are, first one is atrial contraction. Atrial contraction. So in atrial contraction, what happens is the atria. So there are two atria and two ventricles in the heart, and the right atria and the right ventricle is separated by tricuspid valve. Left atria and left ventricle is separated by the mitral valve. Mitral valve is a bicuspid valve, and all other valves of the heart is tricuspid except mitral valve. So what happens is systole means there is contraction of the atrium. Atria contracts, and so what happens is as the atria contracts, the tricuspid valve and the mitral valve opens and the blood from the atria flows towards the ventricles. So this is the first step regards to cardiac cycle. So second step is isometric volumetric contraction. So in isometric or isovolumetric contraction, what happens is the blood from the atria reaches the ventricle, and once the blood from the atria reaches the ventricle, the tricuspid valve and the mitral valve closes because valves prevent the backflow of blood. So it closes. So what happens? This ventricle is full of blood now, and there is increased pressure inside the ventricles. So this stage is known as isovolumetric contraction. That is, both the ventricles, the blood is full and there is increased pressure inside the ventricles. So this is isovolumetric contraction phase, and this is followed by ventricular ejection. So when the pressure inside the ventricle increases, the pressure in the aorta and pulmonary artery is less than that of the ventricles. So when there is a tendency of the blood to flow from the high pressure area to the low pressure area. So what happens is aortic valve and pulmonary valve opens and the blood from the ventricle flows towards the aorta and the pulmonary artery. This is known as ejection phase. So the ejection phase, and this isovolumetric contraction and ventricular ejection constitutes the ventricular systole. It constitutes the ventricular systole. So now what happens? The blood from the ventricles flows towards the aorta and the pulmonary artery. Now ventricle is empty, and what happens is again the atria is filled with the blood for the next cycle. So what happens is next is isovolumetric relaxation phase. All the blood from the ventricle flow towards the aorta and the pulmonary artery, and the ventricle is in the relaxation phase. And the blood from the systemic circulation, as well as the venous blood, and also from the pulmonary is flown towards the atria. This is known as isovolumetric relaxation phase. And next it is followed by ventricular filling. So ventricular filling means again the pressure in the atria is more than the ventricles. So what happens? Mitral valve and the tricuspid valve open, and the blood from the atria flows towards the ventricle. And the cycle repeats, as this is a cyclical event. It is known as cardiac cycle, and the major portion of the cardiac cycle constitutes ventricular diastole, and the small portion constitutes the ventricular systole. And the total time taken for that is 0.8 seconds. So this is regarding the conduction system of heart. This is the electrical activity of the heart, and as the conduction system is there is electrical activity. We are able to plot the electrical activity of the heart in a graph known as ECG. So this conduction system of the heart, so we all know that cardiac cells are specialized cells, and there are specialized cells in that specialized cardiac cells known as pacemaker, and this pacemaker of the heart, physiological pacemaker which is present in our body is SA node, sinoatrial node. And this sinoatrial node, the capacity of that node is it can produce impulse by itself. So SA node, it is situated in the right atrium. SA node, it is situated in the right atrium, just lateral to the opening of superior vena cava. Superior vena cava and inferior vena cava opens in the right atrium. And this sinoatrial node or pacemaker of the heart is situated in the right atrium, just lateral to the opening of the superior vena cava. And there is another node known as AV node, atrioventricular node. It is also situated in the right atrium, just lateral to the opening of the tricuspid valve. Tricuspid valve is between right atrium and the right ventricle. So just lateral to the tricuspid valve, there is a node known as AV node. And this SA node and AV node is connected by means of internodal fibers. So there are three internodal fibers. One is anterior internodal fiber, posterior internodal fiber, and middle internodal fiber. So these are the three internodal fibers. SA node connects AV node with the three internodal fibers. And from the AV node,
So it is not audible now. So this may get disconnected within 1 minute, and you please rejoin again with the same.